एक ऑक्सीजन मास्क होगा इसमें. ऑक्सीजन मास्क लगा दिया.
Remember to introduce Dr. Kapil. Remember to introduce yourself, who you are, and what you're going to be doing. Okay?
या इधर आ जाना. तेरे को इंट्रोड्यूस नहीं कराऊंगा. तेरे को इंट्रोड्यूस करूंगा. ऑक्सीजन मास्क, ऑक्सीजन मास्क, ऑक्सीजन मास्क.
इसके बाद तेरा करवा के मैं से ज़्यादा दो बार फोन आ गया उठी से तो मैं 9 बजे का बोल के आया था 11 बजे उससे बात करते हैं तो पीएरएस तो करा दो पीएरएस करा दो बिल्कुल.
Okay, I'm going to count you in. 3, 2, 1, go. Okay, Chris? 3, 2, 1, go.
Hi, good morning. I am Professor Kapil from Anaesthetics Medical College and welcome you all to the Meditech X. I will be explaining you about the surgical cricothyroidotomy. So the surgical cricothyroidotomy is an important step because as per the Difficult Airway Society guidelines of 2015, when you are not able to do a proper laryngoscopy, when you fail in supraglottic device insertion and the attempts at mass ventilation fail, then that's the only crucial step of front of neck access, right? So when there is a failed intubation and failed oxygenation in a paralyzed or anesthetized patient, we need to do the front of neck access. Before we do any procedure, we need to know the equipment which should be ready available for that procedure. So for that we will, since it's a scalpel bougie technique, so the equipment which should available should be like the one is the scalpel, that is we should have a 11 number blade scalpel, then a bougie of around 15 French, then a tube of around 6 millimeter internal diameter cuff tube, and then a bag mask to check the placement of the tube. So the steps, I will just telling you the steps in brief beforehand so that we get to know it when we are doing the steps. So whenever the situation arises, we have to continue the steps of oxygenation, though the oxygenation has been failed because of intubation, supraglottic device and mass ventilation, but still oxygen has to be applied, steps has to be continued. If you are a right-handed person, you have to stand on the left side of the patient so that you are able to do the steps properly. So since I am right-handed, I am standing on the left side of the patient, right? So first, then you have to perform a laryngeal handshake so as to identify the laryngeal anatomy. Then I will stabilize my larynx using my left hand, and I will use the index finger of my left hand to identify the cricothyroid membrane. Then using a scalpel, I will make a transverse incision, right? The transverse incision will be inserted with the scalpel pointing towards me. Then it's a stab twist technique. So first I'll give a stab, then I'll do a twisting of my scalpel. Once I do a twisting of the scalpel, I'll have to retract my scalpel towards my side, then I'll insert a bougie over which I will then railroad the technique. So the proper steps we'll show you as we go. So the first and foremost step is the laryngeal handshake. For the laryngeal handshake, you have to use your index finger and the thumb of the left hand. So first you have to palpate the greater cornu of the hyoid bone. Since the larynx is a conical shape, then you come down and you feel the thyroid cartilage. So you feel the thyroid cartilage and then you feel the cricoid. So once you feel the cricoid, then using the you have to stabilize the larynx using your thumb and the middle finger, and using your index finger you have to identify the cricothyroid membrane, right? So once you identify the cricothyroid membrane, then you have to hold your scalpel in your dominant hand, that is the right hand, and where the space you are finding the cricothyroid membrane, you have to put a stab. The stab has to be given. So once the stab is given, you have to just twist it by 90 degree. So this will make an opening wide in the cricothyroid membrane, and then you retract the blade towards your side. So once you retract the blade towards your side, then you need to change your hands. You hold the scalpel with your index finger, and then with your right hand, you have to make sure that this blade is not tilted, the scalpel is straight, and then you insert through that space, you insert the bougie. So the bougie has to go around 10 to 15 centimeter. There are markings on the bougie. So it goes around 10 to 15 centimeters, so in the trachea. Once the bougie is there, I remove the scalpel. So once the scalpel is removed, now I have to railroad my tube. So I take the cuffed size 6 tube and then railroad it over the bougie. So once I enter, I have to go in a twisting movement. The twisting movement will insert the tube into the trachea. So once it's around 5 to 6 centimeters inside the trachea, I remove the bougie and I inflate the cuff of the endotracheal tube, and then I check the ventilation to see whether the tube is there or not. So I connect it, and you can see when I inflate, the lungs are getting inflated, right. So this is how you do it, and this is a very important step of rescue in case of failed oxygenation. Thank you. It went well.
पेटेंट कर लें पेटेंट
पेटेंट तो करवा देंगे हमारा, हाँ पेटेंट कर लेते हैं सर, दास